So good afternoon, everyone, and hope you are all doing well. Thank you very much for attending today's Ardens webinar, in which we're going to be looking at the GP contract updates for this financial year. Always a popular topic. So hopefully you're going to find it very, very helpful. We're going to be particularly focusing on QoF and network contract DES for today's webinar. So my name is Charmaine Jackson and I head up the training team for Ardens, and I'm also joined by my colleague Nathan, who I'm sure you've all met before. And Nathan will be leading on today's webinar, not myself, I'm just doing the introduction part. So the Ardens webinar today is for SystmOne practices only. So if you are an EMIS practice, unfortunately, you're not going to find this very helpful, but please join me tomorrow, because I'll be doing your webinar tomorrow at 1 o'clock, and I will get my team to share the link to how you can register onto that webinar. And really just a reminder that every webinar that we do, it's really a top level overview that we are providing. We would love to be able to go into more detail, but we're a bit limited on time. So please do remember that this is not your only training session. We've got so much training that you can tap into, including time to book in with one of our training specialists to go into detail how to use these resources and talk about how it will work for your practice. So make use of that, and I will get the team to pop our training email in the Q&A. We will remind you of training throughout the webinar as well to make sure you are taking up that offer. So in terms of housekeeping then, this is another busy webinar. So Nathan, if you don't mind, pop into the next slide for me. So it's another busy one, like mentioned. So if you are brand new to our webinars, what you will notice is you're not connected to a microphone or a camera, and that will remain that way all throughout the webinar. So if you do want to communicate with us in any way, then please do make sure you can find the Q&A section, because that's how you'll be communicating with us. We've got Nicola, who's one of our training specialists. We've also got Nick, who is one of our senior developers, and we've got Craig, who's one of our developers too, who are all here to help answer any queries or listen to any feedback that you might have about anything that we're showing you in today's webinar. This session has been scheduled for an hour. It will be recorded, and what we do with the recording, we send out an email to everyone that's registered on the webinar with the recording and how you can book on for training, and we do also make it available on our website as well, so that you can listen back to it as many times as you like. We probably will pop a few poll questions on throughout the webinar. Those are normally good for engagement, just to find out who we have in the room. And I'm going to take this opportunity to do the first one now, actually, because it'd be good to understand what your job role is. So if you just bear with me, I'm just going to fire off a poll question now. Just wait for it to load. I'll get Nathan to go to the next slide while we're waiting for that to load.
There you go.
There we go. I'm just going to launch this question. Let us know, are you a practice manager, administrator, perhaps you're a GP or nurse who wants to find out a little bit more? If you could just submit that for me, that would be great. Hopefully that's popped up on your screen. Let me know if that poll question has popped up. If not, I'm going to keep going. I think we might have a little bit of an issue there. Oh, there we go. There we go. Yeah, brilliant. Okay, cool. We've got some nurses, got lots of practice managers on the call today. Keep clicking that. Other, let us know in the Q&A if your role's not listed. It's always interesting to know who we have in the room. Cool. Perfect. So lots of practice manager, quite a lot of nurses as well, which is nice to see too. Okay, so what we're going to be covering today, so in terms of what we'll be covering, and we're going to do it in this order too, we're going to start with a quick summary of what the changes are for GP contracts this financial year. We're then going to look at the Ardens resources that we have available to support you with this. So Nathan's going to take you through a live demonstration. We're going to cover QoF first. We're then going to move on to network contract DES, particularly focusing on IIF. We're then going to talk about next steps, and then we're going to look at ongoing training and support that is available for you. So hopefully a lot of you have been using our resources already. We have just made sure that they're updated to be in line with the changes this year. So hopefully none of it is a massive surprise to you. I'm just going to launch a question while we go to the next slide, just to see what resources you are making use of, because remember, we've got templates to support you in this area, we've got reports to support you in this area, we've also got our Ardens Manager dashboard, and what we're going to do is we're going to be covering both the dashboard, so Ardens Manager, and we're also going to be looking at Ardens Clinical today as well. So it's good to see that quite a lot of you are using a mixture of the resources that we have available, which is good. Okay. So just a really quick one then on summary. Like I mentioned, I'm not going to spend too much time. I'm going to start with QOF first, because normally this is the biggest area when it comes to meeting contract requirements, particularly for practices. Like I mentioned, you're probably aware of a lot of this already. We will also share the slides so you've got something to refer back to. But I feel like I say this every year, to be honest, but it's no different this year. There hasn't been a massive amount of change to QOF this year. And NHS England let us know earlier this year that they would be continuing to build on the changes that they've implemented on the recent years. So hopefully nothing really for us to panic about. The focus is mainly around capacity, shifting from treatment to prevention, and also looking at vaccinations too. So I have got a few headliners there, and we have included this in our bulletin. If you're not receiving our monthly bulletin, I really recommend that you do sign up for that, and we can show you, we'll give you a link on how you can sign up to our bulletin, because it lets you know everything that we're doing for you and also what's happening in primary care. So as mentioned, we mentioned about these GP contract updates at least a month ago to kind of give you the heads up of what was coming. Now, in terms of the QOF point value, that has increased. It does that every year anyway. So this year it has increased to £227.95, so just a couple of pounds more this year. They have introduced some new indicators, which I'll speak about in a minute, which means that there are now 18 additional QOF points that you can work towards, and there has been a couple of point adjustments and thresholds for this financial year too. Next slide for me, please, Nathan. So there are 6 new indicators which you can see on screen. I'm not going to spend a lot of time on this because we are sharing these slides here. And to be fair, you probably are doing a lot of work on this already, and you've been doing the work on it in previous years. They've just rejigged it around a little bit. So particularly working towards BP control for your CHD and stroke patients, what they've done here is they've moved it into its own domain now under cardiovascular disease. So don't be alarmed if you see those in a different area. They've also introduced 8 key care processes as part of QOF now, and areas such as obesity. They've brought in the weight management, which you would have been doing. They've just shifted it into the obesity domain. So hopefully not a lot of it is alarming to you, and you're working towards those already. Next slide, please. Very, very small updates to existing indicators too. So the asthma register now from 5 years old, for years and years it's been from 6 years, now it's from 5 years old, so they've just expanded it slightly. And there have been changes to areas such as hypertension, and they're excluding the frailty cohort, stroke, they've added more treatment options, etc. So very, very small changes. And when it comes to thresholds of point adjustments, they've increased the threshold for AF, and they've also reduced the points for cholesterol, and they've increased the points for diabetes. So that just indicates what those are on that slide too. Next slide for me, please, Nathan. Now we've got retired and replaced indicators there. So normally when they make a change to an existing indicator, they replace it with a new indicator number. And so a lot of this here haven't been retired completely. They've just replaced it with another indicator numbers, particularly around hypertension. There have been, so I think most of those have been really replaced rather than gotten rid of completely. But I think probably the biggest change that we are probably all very happy about is the childhood vaccinations, because I know how tough it has been for you all to be able to achieve that indicator over the years. Now, the actual points and the thresholds haven't changed at all, but what they have done is they have introduced a further improvement threshold calculation, and the whole idea of that is to be able to reward you for at least trying to improve the uptake. We know that there are some times where it's just impossible to get patients in, so at least they're recognizing that for this year. In Ardens Manager, we are working on a way for you to be able to see what that looks like. So if you are an Ardens Manager user, that will be coming at some point, but we will be touching on Ardens Manager in general today as well. Next slide. So I'm going to hand over to Nathan in a minute, but this is just to let you know that we have updated our resources, which you will see today. They're already available, ready for you to start working on your contract work for this financial year. So the templates have all been updated to include all of the relevant indicators for this year. If you move to the next slide for me. What you will notice today that there is a new report folder, and actually it makes things a lot more easier for you because it brings everything together in one QOF folder, and it has been broken down by long-term conditions, smears and vaccinations. So if you're having to prioritize work in any way, this will make it a lot more easier for you, and that is now available for you to start using now as well. And in terms of Ardens Manager, so a reminder, Ardens Manager is our population health management tool, and it allows you to monitor activity at practice, PCN and ICB level. And we actually had these dashboards updated on the 1st of April, which is really impressive. So from the 1st of April, you knew exactly what you were working towards for your individual practice. So if you are an Ardens Manager user, just make sure you've accepted the contract for this financial year. If you're not sure how to do that, we'll put a support article that will walk you through how to do that, so that you can see the work that you need to be working towards. We are doing a more dedicated Ardens Manager webinar on the 12th of May, so we will put a registration link in the Q&A as well, so that you can sign up for that. Lots of new features have gone into Ardens Manager recently, so if you just move to the next part for me, Nathan. So Nathan's going to pick up today our check patient feature. So you know you would have check patient in your clinical system. This is now check patient within Ardens Manager, so you can see where patients have met or not met the criteria of the report. We also have our single patient view, which is brilliant. You can open up one patient and it will tell you exactly all of the different contract reports or reports in general that one patient is on. So that will help with prioritization too, which we will cover for you as well. Just to mention that we know that there are some codes that are not available for QOF yet. Perhaps they're new indicators. We are fully aware of exactly what that is, and we will make sure our resources are updated as and when these codes come into the clinical system. I'm going to stop talking, and I'm going to now pass you over to Nathan to do a live demonstration. Just give us a thumbs up if all is okay so far. Remember to use that Q&A section if you need to. Thanks, Nathan.
Yeah, thanks, Charmaine. Excellent. So with having a look at those kind of updates and things, want to dive into SystmOne and just show you what that actually looks like. Now, I think this year is really nice because I think in previous years we've done this QOF session, we had kind of like folders here and there, but we've tried to streamline it and make it a lot easier for you. So what I'm going to do first is I'm going to go through some of the reports that the folder structure, and just kind of go over what changes there are and just kind of go through what resources there are. You'll probably see that a lot of the reports in there are similar to previous years. So, you know, it should be very easy for you to kind of pick up and use these, and hopefully easier for you to find them. So I will go over kind of like the reports that we have available for you to use first. Then I'll just dive in and show you some like the QOF resources with regards to like the templates and things like that. So I'm going to cover that. Then we will look at IF, and Charmaine will go for IF, but we're going to look at QOF first. So we'll look at those reports. Now, first place I'm going to go then is the reporting screen. I'm already in there. You probably know how to get here. You're probably all using reports, but just in case, what we have done is we've gone up to reporting and we've gone to clinical reporting, which is obviously the reporting screen where you build your reports, which is the screen I'm in. And then on the left hand side, as you are already aware, you've got like my reports and local reports where you build your own reports, and then you have access to our Ardens Limited folder. And what I'm going to do is I'm going to open up this folder by clicking that little icon to the left of it, and we've got all of these folders. But what I'm going to do is, and you probably might not have seen this because it's only just become available, we did have the QOF folder kind of the previous years, and up until last week we had the 25-26 one. But as you can see now, we've got contracts, 2026, 27, quaff. And if you've used this folder before, you'll notice now that if you open it up, it looks a little bit different. But we've actually added a few more bits to it, and it will hopefully flow and make a bit more sense. And this is a lot of you might not have seen this yet, so we'll kind of go through this. I just want to kind of stress before I kind of go through all of these options on here is, as you know, SystmOne does come with a lot of built-in quaff reporting already. So we do say, still use that. And I won't be going through those now, but when you go up to reporting, remember you've got your quaff indicators and you've got your quaff tools. So you have those. Now, those are still useful. There's no point us reinventing the wheel when they exist. So you can quickly see your registers and that sort of thing in there. So where applicable on our folder structure, we tell you to go there to use those rather than us rebuilding them in our folder. But what we like to do is add a few more extra bits and bobs to help make your lives a bit easier, and reports that might not exist in those quaff indicator folders. So it's kind of like that enhancement, if you like, to kind of make things easier for you. So looking at this quaff folder then, I think the other thing to say is this is kind of like an overview of all quaff. After I've gone through this folder, I'm quickly going to go through how you would still use like the conditions folders to get into the real nitty gritty of specific conditions, and how you might use your recall process, or, for your long-term conditions and your vaccinations. So we're not trying to replace that. That would still be in place. This is just a handy folder to use just to get an overview of kind of how quaff is going at your practice. So this new folder structure then, and a lot of these we've covered in other training sessions, it's just in a different place now. So when we open up the quaff one, the first one, we've got this whole section for your long-term conditions. So any reports that we think are useful to do with quaff and your long-term conditions live there. And the first one we've got, which we always bang on about in every session I ever do, it's your case finders. So this, on the whole, it's no different to anything we've ever done in any of our other sessions. And if you've done maximising income with us or previous quaff ones, they are the same, but they are now kind of listed at the top there. Your case finders, for those that don't know, are basically identifying patients at your practice that may not have a current diagnosis of something. And with regards to these obviously kind of your quaff conditions. But there might be something in the record that indicates, well, maybe they should have that diagnosis. And so when we go in here, you can see all of these reports, and we've kind of split them up by kind of area. But, for example, you've got all these asthma ones here. So, the one I always show is you have a report here that they all have that question mark, query. So this is saying query if you should code asthma, as these patients have been coded as resolved, but they have had an inhaler issue to them in the last year. So, if you run that as a practice, and again, if you've seen this before, you'll probably know exactly what these are doing. But I'm always amazed people still don't know these exist. And what that's doing is it's going, well, hang on a sec, we've got 6 patients at our practice that were all basically, they had asthma, but someone's coded they don't have asthma anymore. But kind of since then, they've come back and asked for their inhaler. So it's a case of well, actually, we should probably review these patients, because if they're asking for their inhaler, there's probably a reason they need their inhaler. Did we mean to resolve their asthma? Has their asthma come back? And you can kind of identify these patients and kind of dive in and work out what do we need to do with them. And that, in essence, is what these case finder reports do. There are all sorts. Again, I won't go for every one. It's just once you know how one works, you know how they all work. So, we've got another one here, which is basically saying, should these patients have a diagnosis of diabetes because their HbA1c, their last HbA1c was coded as being over 48. So again, we can look at those patients and just make sure we're not missing out on anyone. I mean, with regards to that one, your nurses might know about some of them because they might be pre-diabetics or something, but at least it allows you not to miss anyone out. And the idea is, by running these reports, you can kind of, you'll be finding patients that might have missed off your register, or they might even be coming in for their reviews, but they just weren't coded correctly. So we can make sure that our register is as clean and, up to date as possible. And obviously more people on the register, essentially, it's more reviews and it's more kind of quaff points, and it's obviously all about patient care, but that would mean that you're getting more work done, and it's kind of more income as well, if you look at it from that point of view. So they're really, really useful reports to run. Now, those that know about those already, they're pretty standard. We have actually added 2 new reports here for this quaff year, and that is around the kind of the the heart failure patients. What we've got here is the one I've just highlighted. So query heart failure with reduced ejection fraction. Consider recording reduced ejection fraction as they had an LVSD. So last year, the QOF register, so the QOF indicator for that one counted patients that either had the reduced ejection fraction or LVSD, whereas now LVSD has dropped off the indicator this year. So we've basically updated this report, and that will basically identify anyone that might have been coded as having an LVSD last year, but they don't this year. And that because again, I'm not clinically trained, but because they're kind of very similar, it might be a case of, well, should we review those patients, and is it possible for us to code that reduced ejection fraction on their notes to make sure that they are getting picked up for that indicator. So it's those sorts of things, and that these two here are the new ones that we've just introduced into here. So you would not have seen those before. The rest of them are the same, very similar, but those are two new ones that we've done in there. But those are your case finders. It might be worth, I was going to jump into the templates in a minute, but it might just be worth me talking about the template we've got to help practices manage some of these case finder reports as well, because we sometimes get queries where people say, well, I've reviewed all of these patients and I know they don't have that diagnosis, so I want to take them off that report. So we do actually have a template that practices can use where you can say that that diagnosis is excluded. So you could say, I know they don't have that condition. It doesn't get rid of the condition. It's just like a code to say, it's been excluded. I know they don't have it. And that would then remove them from those reports. Now, it's important to say it's not every single one of those reports has an exclusion code. It will depend on the thing that you are looking at and whether that code exists. So it doesn't apply for all of them, but where applicable, it is a useful thing to do. So I have my patient open. I'm going to show you this template now just while we're on this bit. So let's just say we were running one of these, maybe the asthma ones, and I've decided that, they definitely don't have asthma, so I want to take them off that report so I don't review them in the future. When you've got your patient open, we always bang on about F12. If I press the F12 key, we get our launcher up, and there is a template I think we've got a support article for this as well that the guys can share in the Q&A, but we have a template called diagnosis excluded. If you don't know where it is, if you just type diagnosis excluded in that search box in the top right and click search, then it would find the template for you, and then you can drag it to your left hand side to save it as a favorite. But if I double click on that template, it even explains to you here, look, if the patient has been identified, well, it basically kind of talks you through it. There's a link to the support article, and what those basically are doing is, I've reviewed that patient. I know they don't have asthma, so we've got the code of respiratory disorder excluded. And if I tick that, that would remove the patient from those case finder reports. As I say, not every single condition has one of those. And there might be times when you don't want to exclude them because it might be that you actually have to run some tests or do something like that. So only use it where applicable and use it when it's clinically relevant. But for those patients that they definitely shouldn't be on those reports, then tick that, and that would remove them from there. So just worth knowing about that. So that's your case finders. Going down, so registers. Now, like I said at the start, SystmOne has a lot of built-in. There's no point us replicating the registers in there. Those registers can be found in your QOF indicators. So that folder is there just for consistency, but you would be going up to reporting and QOF indicators to then view those registers like you normally do. So that is no different to how you probably do them already. So that's why we've kind of put that there. But we've got a few other things. So the next one on the left-hand side is your time-sensitive reports. So these are those QOF areas where there is a time limit in when you have to get the thing coded. There used to be a few more on here. Obviously, QOF was reduced a few years ago, but it's usually around those kind of echo specialist assessments for heart failures, the structured education reviews for diabetic patients, and then there's always that asthma register. So, if you were diagnosing a patient with asthma, it has to be coded what tests were done to kind of show why they've got asthma, and that test basically has to be done 3 months before or after the diagnosis is coded. These reports will show you how long you've got to code when that test was done. So, we've got 0 to 1 month left. So if we ran that, we'd be able to see we've only got a couple of weeks left to get these patients coded as, what test was done, 1 to 3 months, and then ones where the time was expired. But again, it might be that it was done, it just wasn't coded correctly. So we can review those patients and potentially backdate that code if it was done and just not coded. So again, just another way you can look at these reports. If you use the cough indicator screen, it will just show you which patients are missing. It doesn't give you a time frame and stuff, whereas these do. So they might just help with a different way of approaching those. So that's your time sensitive. And we've got these. Now, these are long-term condition to do. So these are new. Again, I wouldn't use these to manage your patient. Don't use these to start recalling patients in. This is just to give you a good kind of synopsis of how you're doing. So you'll notice it says outstanding cough, how am I driving, LTC all, and then you'll notice at the moment it says V50 in brackets. So like Charmaine said at the start, there are still some codes that have not been released. And we are waiting for SystmOne to update their reports to the new QoF rules, so like version 51. When they do, that will update to version 51. So we are aware those are only version 50. This reports would probably something you run towards the end of the year anyway. And what they're basically going to do is going to show, how many patients have you got left overall that still has kind of outstanding QoF work. Just gives you a snapshot. You might go other places to manage these. It's just giving you that overview, and then you can break it down by all those that are in a care home, or those that are housebound, or excluding those basically. Again, I would probably use our long-term condition recall process to manage these, or another means, but this gives you a nice snapshot overall. So all the other work you're doing will feed into these reports. Next subfolder is you've got your data quality reports. So just a few other things around maybe someone's coded something wrong. They're just like handy reports to have that you can go in and run every now and again. So things around kind of like your cholesterol, or maybe someone's used the wrong smoking code, so it wouldn't be picked up for QoF. The top one is a useful one for me to mention though, where it says, and this is a thing with SystmOne and how it works, and some of you might have seen this before, but this is basically saying, query mental health diagnosis not marked as new episode. So what can sometimes happen is if people can remain on the mental health register because they've got an old kind of diagnosis code to put them on the mental health register, or maybe they've had two separate instances of some sort of kind of mental health disorder, and one they're both put on as new episodes, so then it can reset QoF or do things like that. So what this report does is it looks at any patient where they've got some sort of mental health diagnosis, but it's not coded, or not coded, it's coded but not marked as a new episode. And then you can review those patients and see, what was the earliest mental health code added, and then make, and basically just change that as the new episode. And then if anything's been added since, say that's ongoing, because if it's always added as a new episode, it just resets QoF. This is more SystmOne kind of functionality, but this will help with that. Now, there is something else I want to show you, which this is not really an Ardens resource or template, but I think is useful to help you with this report. And I'm just going to go to my patient in the top right. So this is just something, this is to do with the mental health stuff. So I know people before have struggled to find specific codes. Why is this on the mental health register? What was the first code that was added? How do I mark it as a new episode? What you can do, rather than looking at your journal, there's a little nifty thing we can do here. So if I go on on your tree, you will all have something you should do. You should all have something called QoF alerts and analysis. Barry, my test is a test patient list, so it's not the best example, but you will have something called QoF alerts and analysis somewhere on your tree. When you go to that, this will give you a list of what QoF alerts there are, which is useful in itself. But there is a tab that a lot of people do not realize exists, and it's called Clinical Data by Read Code Cluster. And if we click on this tab on the QoF alerts and analysis screen, we can go here, and every single one of these on this list is all the registers for QoF. Now, in this box here, because we're talking about mental health, if I type MH and click search, it will find the cluster of codes to do with mental health. And can you see here it says psychosis, schizophrenia, bipolar affective disease codes. So these are the codes that would put them on the mental health register. And if I click on that, on the right hand side, it will show you every single code in that patient that falls under that register. And I can see the date and the code that has basically made this patient be added to that mental health register. So in the case of this, they were coded as having schizophrenia on the 26th of May 2022. So for the instance of that report I was just showing you, they might have 2 or 3 separate codes at different dates with different episodicities. Now, if you want to know what your episodicity is, if you hover over this little icon to the right where my mouse is there, I'll do that again. We can see that's a new episode. So you just want to double check which one's a new episode and which one's ongoing. And if I right click, you do have the option of going down to episodicity and marking that as either new episode or ongoing. I don't want to get into any of that in more detail because this is more SystmOne functionality. This is something we can help you with in training if you wish. And we will talk about booking training at the end, but I think it's a really good tool to use for any of those. It doesn't even have to be about this, it could be about anything. So just if you don't remember anything else I just showed, if you remember this clinical data by Rico cluster to do with that, that is really useful. So right, let's go back.
You got a lot of love on that one. A lot
really?
of emojis, so it
I
must
thought
be
it might
useful
be.
for people.
I thought so. Yeah, that's why I wanted to show it because a lot of people do not realise that exists, and it doesn't have to be used for mental health. It could be used for anything. So it's just knowing that exists. It could be for any. You might just wonder why a patient's on a register and where the code is. You can find it on there. So just a good little tip.
Thank
cool.
you.
No worries. Right, let's go back to our reports then. So that's your data quality, but that's a useful one to do. Next subfolder is your personalized care adjustments. So this is really useful for your LTC stuff, and your recall process. Again, we covered this in the long-term condition webinar, so I don't want to kind of spend too long on this, and we have support articles for this, but what these would do is the top 2 reports, well, I'd say this is probably going to do. So we've got a report here that if you are using, I appreciate not everyone on this call will be using our long-term condition recall process, and we have a separate webinar for this. Those that are, this report will basically say these patients have had their long-term condition review as marked as completed. That's the Ardens long-term condition review, but they still have outstanding QOF. So again, right now, you're in April. You probably don't need to run that. The last quarter of the year, really good report to run and go, why did the clinician mark that as completed? Because they still have outstanding QOF, and you can dive in and work out what else is needed to be coded to make sure you pick up your QOF. So again, that's just a useful report. And these, again, more to do with the long-term condition process. I'm not going to go into loads of detail now just because I'm conscious of time and I could spend all day on this. But if you are using our LTC process, these reports will help you retrospectively add the QOF invite code and backdate it. And if you add it twice, it would add a personalized care adjustment to their record. Again, I don't think this is something you need to be running now because it's the start of the QOF year. Say from January onwards, these are really good retrospective reports to run to then maybe exclude certain patients from QOF because it's going to automatically add that personalized care adjustment. We have a support article on this, and this is something that I would encourage if you are interested in our long-term condition process. Book that training and we can go into more detail. I think I covered this in our long-term condition webinar as well. So just that is there. It's now sat there for the new year. And then the last one on this LTC bit is your achieved. But again, we just chose to go to the QOF indicators because it's very easy in that screen to see what you've achieved and who's had what done. Also an Ardens manager, which we'll touch on a bit. Then you've got very similar structure for your smears. So just your registers, again, we're telling you to go to the QOF indicators because your registers are on there. Just for consistency, we've got the subfolder, but you don't really need to use that one. We do have the to-do, again, separate reports elsewhere to help you manage this. This just gives you an overview of your 3 and 5 year smears. How many patients have you still got left that QOF year to get in? So you've just got a snapshot. Easy as that. And again, I imagine the achieved will say, look at the cough indicators. So, they're just telling you where to go, but it's giving you that kind of structure. And then same for the vaccinations. You've got your registers. Again, look at the cough indicators. Your to-do will show you each indicator to do with the vaccinations and how many patients you've got left to code for that year. And the achieved, again, will probably tell you to go look at the cough indicators. So a lot of that is what we've had before, but we've just tried to structure it in a neater way. I'm hoping that makes sense. I'm going to dive into IF in a bit. What I want to say, though, is there are other resources to help you actually manage this. So just think of that cough folder as just an overview of all of that. If I scroll up, what you might want to do is dive into this in a bit more detail. And this is stuff that I've covered before. So you have all of these conditions folders. So for example, if I go to conditions cancer and open this one up, we've got a load of different reports in here. Now, what I wanted to show you is you've got all of these screenings. So smears, yeah, it's all very well knowing how many we need to get done left. Smears are done centrally. They get sent out invites centrally by NHS England, but you might want to know who's not responded to that. So what we've done is we've built some reports in here to help you actually manage those patients rather than just look at the dates, the data like in that cough folder. So for example, in here where we've got screening, we've got this one which says for non-responder invite. So essentially what it's doing, can you see there's all the smear ones there? So that I've highlighted. So any patient, they are probably sent 2 invites centrally to say, please come in for your smear. And, correct me if I'm wrong, I'm sure you all manage this slightly differently, but you would then get something back to your practice to say, look, these 20 patients did not respond to our 2 invites for their smears in the last month or whatever. And they then, in theoretically, will get coded as a non-responder. What we've done is we've built some reports to help you manage those patients. And they are here. So you've got your 25 to 49-year-olds, and your 50 to 64-year-olds. So these ones here, I mean, we've done all, but then we've split them up by anyone that, have no accessibility, or, you might have patients that will have reasonable adjustments and things like that. So that's why we've done like that. But in theory, you would review that patient and you could then send them a reminder to say, we know you were invited twice. It's really important to have your smear, contact the practice, and you could use those reports to chase those patients up. But that then feeds into that cough folder because you're going that extra mile to get them in and hopefully get that work to do done. So it's just worth knowing we've got those in there for your smears, and that's in the cancer folder. And then you can drill down into all of these by different disease areas. So for example, if I go to the conditions respiratory folder, in here, we've got performance indicators. So again, it's all very well, this drills into all that asthma and COPD stuff, and all of the folders flow the same way. So rather than just looking at the cough indicators going who's missing for a cough review, we could come in here and all of these little bits are different aspects of that cough review. So, no care plan in the last 13 months. Now, right now, we're at the start of a cough year, but as you go on through the year, especially towards the end, this is really useful because it might be that they had their review, someone just forgot to code the care plan. So if you run that, that's going to show you any patients that hasn't had a care plan coded. But what you can do is you can dive into those records and actually go, well, actually, they had everything else done. They just forgot to code it. So it's no different. It's your missing patients, but you can just look at slightly different information and kind of capture it like that, if that makes sense. So again, just another useful tool that you could use. I will mention the next bit. I cannot show you this, so this is the sort of thing we can cover when we give you individual training if you want it. But we have created a report output that shows you all of the different aspects of a cough review for things like asthma and diabetes. And the idea is if you ran your asthma register report or ran one of these and then did right-click show patients, you can get your list of patients up, and there is a button at the top. Again, it's really annoying. I can't show you. We just can't because there's patients in there. There is a button at the top that says select output. And one of the outputs on there is called, I think it's asthma cough, and it says Ardens. It's called asthma cough. And what will happen is your screen will refresh and you will have a heading for each component that you would do as part of an asthma review. And if there is a code in there, it's been done. It will tell you the date it was done. If it's empty, it's not been done. So at the end of the year, you can see a snapshot of all the patients you had done and when it was done, but you can see if anything's missing. So you can see those 10 patients, they did everything, but the care plan wasn't coded. So then you could do a quick win, send out the care plan, code it. So it's annoying I can't show you, but it's just a report output, and it's called asthma quaff. And again, it's something that we can kind of train you individually as well, but just another thing that might be useful for those. Basically, don't forget about those conditions folders, because they've all got these performance indicators in, and it just breaks down each review in a better way. Just a couple other things, reports, and I'm conscious of time. So not only that, as you are aware, we did a webinar the other day, so do not forget about our long-term condition review process. We are going to be doing regular webinars on this, and we can share the recording of that as well. But there is the folder there, and this is where you can actually do your recalls to get the patients in for their reviews. And in here, essentially, you've got the ability where it breaks it down by month of birth, and you can then send out invites, code it, and send first, second, third invites to those patients to get them in for their reviews. It's really, really good. We've updated it this year as well, but that will really help you manage this quaff stuff, because if you're getting everyone in, you can get everything done in one go, and you can use these reports which basically don't miss anyone off, and they get everyone done and can reduce your appointments and things like that. Again, it's a whole different beast altogether, and we've got a webinar we can share with you, but it's more just don't forget that's where you would actually do your recalls there. And then for the vaccinations, it's all very well looking at the to-do in that quaff folder, but where you do the work is in the vaccinations folder. And if we open up the vaccinations folder, we've got all of our childhood stuff here. So again, if I go to childhood there, we've got our first, second, and third there. And what this will basically do is identify any patient at your practice who is due their 8-week vaccinations, and we could use this process to invite them in to make sure that they get those done. So if you're using that, you're getting everything done, and it's feeding that quaff folder. Again, we've got a separate webinar that we have already done on the childhood vaccinations that we can share with you. Again, a lot to cover today, so I don't want to go into more detail. It's more just telling you, the quaff folder has been updated, but still use these other bits to then feed into that folder. So I hope that makes sense. Now I'm going to jump into the templates. So I'm going to go to my patients just to show you a few other things with regards to the templates. Now, a lot of this is familiar to you. As you know, when a patient has a condition, they should have the icon under their name in the top right. So for example, this patient has asthma, therefore they've got the blue inhaler under their name. If I click that, it will open up our asthma template. And this is, all been updated. They all have the review tab. And if I click the review, this is where you would do your review. And as I say, we have been updating these templates. So this is all kind of, the latest guidance, as much as we know with the codes and everything. They're just there. You don't have to do anything. So, and red stars are quaff. So this is no different. You're probably using these already. But one thing I want to say is, yes, I would do this as part of my review. I'm always surprised by how many people don't know this next bit that I'm about to show as well. In all of these kind of conditions review pages, in the bottom right there is a red star, and that red star will open up just the asthma quaff template, and it just shows you the quaff rules and codes and nothing else, because obviously this is best practice. This is kind of a proper consultation. But if I just want to know the quaff rules, if I click that red star, it opens up, and can you see these have all been updated, as Charmaine said in her screenshot as well, quaff 2627 asthma, and it basically explains the exact rules for each indicator and the codes. Now, you don't need to use this to do your consultation. You can use the main template, but this is good for checking things, or what we always get queries around, the blood pressure and diabetes, why is it not clearing? The template tells you exactly what it's looking for and the code. And not only that, these pages have the personalized care adjustments at the bottom as well. So you can add personalized care adjustment on that template. It just makes it easier. It gets rid of all the noise and it just gives you that data. But I guarantee that if you use this template, it might, you might get a lot of the answers you're looking for when you're querying, why is this not cleared? this should tell you. So it's really useful. And look, can you see the tab at the top just to show you if you've still got last year's? So if you want to see the changes, you can flick between those tabs as well. So we can see that was last year. This is this year. So how, you know, it was AST 007 and 12. It's now 15 and 14. So we know that, like as Charmaine said at the start, they kind of changed their numbers, but there's not actually much difference. It's just if there's any small updates and things. In this case, it's because it's 5, etc., that sort of thing. So again, really, really useful template to use. Now, if you wanted to, rather than go into each individual condition template for that, if I press F12, I've got the full-blown QOF template there. So if you search for QOF, they are all there. But you've got a master one, which is just called QOF, which is up there. So I'm going to double click, so I've already got it on my favorites. And then it lists all of those templates and more in one place. So you can go that way as well. You know, so if I clicked on like the diabetes tab, then there's the new diabetes rules for this year. And again, you know, I always find this one useful because people always get confused with regards to like this indicator, because it's a last blood pressure of 140/90. But if it's a home blood pressure reading, it's 135/85. But we do get queries all the time of people saying like, I've coded their blood pressure is 136/86. Why is it not cleared? And it would be like, was it done at home? Yes, it was. Well, that's why. And the template tells us. So again, just really good to see what that is and actually see what's going on with those. And even things like this, you know, it tells you an exception for each LLT is needed if appropriate. So again, we got a lot of people saying, I've put the exception on for the, you know, the LLT, the statins. Why has it not come off? But it's actually because you have to do one for each one. So it tells you that and what the codes are on the drop downs. So everything in one place, which will really, really help you. And I think these are really, really good templates to kind of know they exist. On the QOF page here as well, just back on that master QOF template, another little underrated page is this personalized care adjustments. If you click on that, then you've actually got all of the personalized care adjustments for each indicator as well. So we could add them there. If you need to do it. Again, probably something you're going to do towards the end of the year rather than now. But again, it's just another easy way of doing it, especially at the end of the year if you want to manage those patients. So yeah, that's just some of those kind of those things there. Just very quickly, and then we'll dive into IF because I appreciate this is taking quite long. If I press F12 again, I've just saved them all, but don't forget, you know, all the other QOF stuff. So, you know, we've got our smear template to record smears, which is also QOF. So I've got my smear template on my F12. If you do smears, you probably already have it there. But just to show you, obviously, you know, this is when we're doing our procedure for a smear, the red star is capturing your QOF, but it's got everything in one place to code those smears. So everything's been updated to make sure it captures QOF. And the same if I just go F12 again, for our new childhood vaccinations template. Now, again, we did a separate webinar on this, but just again, highlighting the fact that if I go in there, then the childhood vaccinations template pops up. And again, you've got red stars next to each one, you know, including the new MMRV, and each page, you know, if it was a, you know, 8-week-old, there's all the advice, but by capturing the actual vaccination, you're capturing QOF as well. So that all helps with, you know, you're using our templates, we're making sure you're capturing your QOF, if that makes sense. Conscious of time, Charmaine, I think that's me. Any questions on QOF, or do we want to move on to IF?
No, we always know that QOF is going to be a big area, isn't it?
Yeah.
So we could probably do a whole session on QOF. So it's fine. And just a reminder, remember, you can book some training. Please don't think this is the only training session that you are getting. I think they're just general questions, Nathan, to be honest, which have all been answered about report outputs, whether they've been published, what are the yellow stars, probably all of the questions that you would expect in these QOF sessions. So let's keep them going because the team are answering them as we go along. Should we just very quickly pull up the slide for NCD? Because again, with network contract, it won't take long because again, there's not a lot of changes here. Remember, network contract DARES also includes IIF, and also do remember that when we're looking at network contract DARES, we're focusing on doing the work as a PCN, whereas the QOF is mainly focused on just that individual practice. So you're not doing this part alone. So really, in terms of updates, the cancer indicator has become a little bit more clearer for referral. So this is particularly looking at the early diagnosis stage and the screening stage. There's been no changes at all to learning disability, so we continue as we are for that. A change worth noting is continuity of care has come a highlight for Network DES this year. So you are expected as a PCN to identify high risk cohorts and embed a continuity of care process in your practice. We've got a whole nother webinar on that, which we're doing next week. So book yourself onto that if you haven't done that already. And we will show you the reports that we have available. We will show you how Ardens Manager can support you in this area too. Patient access, so they expanded the recruitment. Now you can be looking at GPs as part of your additional roles too, and they've also retired the advice and guidance. However, you are picking that up in other contract requirements. So don't think it's gone forever. It's still there. It's just not part of Network Contract DES. So we, again, have updated our resources to support this. The templates, the reports have had a good update too, which we'll show you. And dashboard has all been updated, ready for you to use for this fiscal year. So Nathan, do you want to have a quick look at what that looks like?
This shouldn't take too long because hopefully it hasn't changed. So back in SystmOne, if we just go back to, I'm going to show you the reports for this. So a bit like the QOF, we've just restructured the folder. So if I go back into our reporting, there is now a folder for 26-27 IIF. It's just a structure. And what we've actually done in here is make it a bit easier. We've just separated out cancer and learning disability. They used to just be in one. They're now just separated. So we've got our kind of data quality stuff with regards to the cancer. And these are just areas where you might have, I don't know, duplicated coding. So it's just a case of reviewing the records to go, why is that code being added twice? Which one's going to be picking up to have the kind of referral? And another one is this one where kind of the QFIT, the date was recorded after the code suggesting that they've got, you know, lower GI cancer. So again, it's just saying, is the fit test on the same day as the referral? Why is it on a different date? Those sorts of things that, you know, you won't always have patients in here, but it just means that you can kind of keep on top of those. And, you know, there's even the one where if the QFIT referral wasn't done for lower GI, record why. Because it is that, you know, these patients haven't got anything coded, so it's just a case of just going in, checking why was it not done, do we need to put anything on the notes? So very good for that sort of thing, the data quality. But then you've just got, it's now achieved that we've got on cancer. We had this before, I think we just had work done. It's now achieved, same thing, and we've got 2 in there. So your lower GI or your with the QFIT 21 days before the referral, so you can see how many you've done basically of each of those. Simple as that. Run the report, you've got your numbers, no different to previous years. And then your learning disability, again, your register, who is actually on that learning disability register, we just put it in there so you can see how many in theory can have that health check. To do is, again, very similar to last year. We had work to do. That top one I've got highlighted is essentially any patient at your practice who is on the learning disability register who have not had that health check and action plan done, and the ethnicity, so that you can then use that to go, well, you know, who do we need to invite in? And these are good. These used to be in a separate one, but they're in this one now. So these are like where maybe they did some of the review but not all of it. So again, it's that query record action plan as the health check was done. So someone's coded the health check was done, but they forgot to code the action plan, and they both have to be coded. So it's just be a case of, why did we code that about the other thing? And then you can backdate it or work out what was going on. Same for, it was coded as we offered an action plan, but they didn't actually say the action plan was done. Why? Again, dive in. And then we've got other things around, you know, we did it, but the ethnicity was not coded. And again, everything has to be done to get that payment. So it's just allowing you to say, that's how many we've got to do. These are a little bit more. They did some of it, but they haven't done all of it. Why? So again, useful just to pick up. Data quality, very similar really. Learning disability, review the health check date as it was actually done after the action plan, but they should all be done at the same time. So why have we done it that way? Again, what's going on? And then achieved, how many you've done. So you've got achieve for cancer and achieve for learning disability. That's going to show you the numbers that you've got done that you basically get paid on. And it's nice and simple, that one. It hasn't changed. That's just in a slightly different format. And again, don't forget, we've got the templates for that. So again, if I go F12, we've got like a master template, which is like the blue stars are anything to do with IAF essentially, and those national kind of contract things. So the template is NCD. If you literally typed NCD and click search, you would find that template. I've already added it to my there. And if I go into that, then you've basically got like the master template, a bit like that master QOF one. And if I go to the cancer tab, it tells me what the payment indicator is and what codes would actually be captured to ensure that payment. In reality, this would be done when you're doing the referral, or from the cancer template or something. So you wouldn't need to come here to code this, but this is just a place to see what the codes are if you need it. And the same for the learning disability. Click that. It's a nice overview. It tells you what the indicator is and the codes that would pick it up. There is the learning disability excluded code that was introduced last year, I believe, but before that you couldn't. So don't forget, again, a bit like the QOF one, it's that kind of exclusion code is included on this master kind of template as well. In reality, and you'll see there's a link to it there, if I click learning disability there, you've got the full-blown best practice learning disability template that if I was actually doing a learning disability review, I would use this template. And if I go to the review tab, the blue stars on there would get you your payment codes, but you need to do everything else as well. Otherwise, it's not a proper consultation. So it's just showing you, if you're using our standard templates, you're getting all these codes. But the master template will just help you with managing that. But this is, again, it's always been there. And again, I won't need to do it now, but just like the QOF ones, can you see in this learning disability one, in the bottom right, we've got a blue star, and that will take you back to that template I've got behind. If I click it now, it's just going to tell me I've already got it open. But if I was in the learning disability template, that blue star will take me to just that master template if I just want to see what the codes are and nothing else. But again, it's not changed. It's very, very similar to kind of what you did before. So, nice and easy with regards to the IAF stuff. Right, is there any questions about Charmaine, or should I jump into Ardens Manager quickly and just go over that?
No, I think we're still very much on QOF. So let's jump into Ardens Manager.
I've got deja vu from last year, because I think that's what happened then as well. So let's do Ardens Manager, because there's some really, really good stuff in here that helps with the QOF stuff. So I'll do Ardens Manager, and then we'll be hopefully wrapping it up then. So I'm just going to bring up my Ardens Manager. So basically, those of you that use Ardens Manager, if you've got the QOF dashboards, then there's some really cool stuff that you can do now. We've already updated, like Charmaine said, we've already updated the dashboards. We did it from the 1st of April. So this was all up to date with the latest guidance. So I'm just going to log in with my smart card. Sorry, just to put my thingy in. And I'll quickly show you that check patient feature, which is, I think it's game changing. It'd be amazing, and it'd be really, really useful way of seeing why a patient is or isn't in a, had the work done, or isn't in a register, or whatever. It's just missing from a report. Again, we will stress, we are doing a webinar on this alone on the 14th of May, and I'm sure we've already put the information in the Q&A. So don't worry if none of this, we will go into depth another time. So I appreciate it's a lot today, but I just think it's a really good tool just to quickly show you. So I've got my dashboard. I've logged into Ardens Manager. Like Charmaine said at the start, do check on the right hand side that if you've accepted the contract, if you haven't already, for QOF and things, to see if you're using it. But what I'm going to do, because I'm just conscious of time, 2 ways to get there. I could go to contracts on the left hand side, and for those of you that are using it, you will have the QOF 2627. I think this is great. At the top, you've got a little search box. I could literally type QOF in there, and then it will bring up your dashboards there as well. So I could just go QOF 2627, and it will open up the dashboard. So you can use that search box at the top. So we've got a little note at the top around the business rules of, subject to testing, because NHS England still sign things off, but we've adapted this to the best that we can with the rules that are out there. And these are, contracts 2627. We've got our tabs across. So we're currently looking at the overview, but we've got our tabs across the top for the different kind of indicators. And we can see that the data is currently as of the 28th of April 2026. We don't have the payment data yet, do we, Charmaine? But we've just got the data at the moment, so that will be coming. But for now, yeah, just got the data in here. And then what we can do is we can see like an overview of all the cough indicators for our practice. A lot of grey because it's the 28th of April. So, we're not going to have achieved much in 28 days. But we can then go, and if I went to show all here on the clinical activity, this is going to show us all of our indicators. So this is that stuff that I wasn't really showing you in SystmOne because you got the cough indicators in there. It's the same information, but you can do so much more with this. So we've got all of our indicators, and as you can see, a lot of them, the thing we're doing best here, look, is our smoking status recorded, whereas, some of the other stuff is empty, but you'd expect that for it being the 28th of April. But let's just dive into one of these. So smoking, for example, so we can see what the thresholds are, where we're currently at, 58.6, which is good. And we can see the lower and upper bounds of our thresholds, how many points we've achieved, how many patients we've achieved, the points we've achieved, remaining, and the there, and we can assign this to people. But again, we go into detail on the webinar on that. But what I want to do is if I click view, then we can dive into this indicator. And every indicator is the same, so it works really well. And we can see like Garden View Medical Centre. Just a caveat: I can see other practices on here because of the how my Ardens manager's set up. If you've got like a PCN or ICB and the arrangements are in place, in theory they would be able to see different practices and how each one's doing. If you're at an individual practice, you would only see your practice unless you've got something else in place. So we can see I'm at fictional Garden View Medical Centre. Again, I can see how we're doing and a little chart showing us how that's gone up and down over time. But again, what I can do is now you've got the patient access. So I can see, well, who's had this smoking status done? If I click the patients, it's going to show me all of the patients that are essentially can or cannot, have or have not yet been achieved for that. And there are their names. And I can see the ticks next to the patients that have had that done. Now, what I can do is I could change it on this drop down to say show achieved only. And I can see who's currently achieved that indicator. And then on the right hand side, we can really drill down into that kind of, ethnicity, and we've got like risk stratification and all sorts on there. But again, what I want to show you now, because I appreciate the time, and we will cover more in detail on the 14th, the new check patient feature. So for those of you that don't know, we can work out why a patient is not on one of these reports. So I'll show you why to start. So on any of these patients, NHS number, they've been achieved, and you've got this little question mark here. And if we click on that question mark, this will run a little kind of report, and it's basically going to show us why this patient exists on this register or why they've been achieved. And you can drill down and see the codes and everything. So this has got a few on there. So we can see this has been included, and it passed on to the rule. So where it says included here, it's here. And basically, if I open that rule up, it's basically telling us exactly, that the patient's age is over 25. They're in this report. And you can see the code. So they've got the code of never smoked tobacco and the date it was coded, etc. So it's going to drill into that and basically tell us this is why they're on the report, because of this code and the date it was added. So it's really, really useful. Now, I was going to do it on another indicator as well, just because I was playing about earlier. So I'm just going to go back to the QOF's front screen, and I just want to go into one of the indicators. So we could do it that way. Let's just dive into diabetes quickly. So if I click on DM, makes it a bit easier. We can look at our diabetes stats for the practice, and we can see, all the exceptions. And then you've got all of the different areas where, latest HbA1c has been. So I've achieved 12 patients there. So we can see who those 12 are. So again, if I click view, same thing again, click the patients tab. And then it will show me all the patients on that that can, in theory, have that. But if I change it to show achieved only, then I can pick these up. And again, if I choose, Hannah at the top, click the question mark to the right, and then it's basically going to show us again why she's in there. But this is a nice easy one to just give you a really good example of how this works, because it's basically going to show you, they've matched that criteria because they had their HbA1c coded on the 26th of April 2026, so we can see when it was done and what the code was. What we can do though is, if you think a patient should be on that register or that indicator or anywhere in Ardens Manager, if you think that patient should be on the report you're looking at, if you paste their NHS number into that box you see below, it says missing patient, put their NHS number in there and go check, and then it will run a protocol for the patient you've whacked in there, and it will run a report, and it will check the patient, and it will basically tell us why. So they've been excluded, and it's telling me, oh, they do have a value below 58, but it was coded on the 1st of March, which is last QOF year, which is why it's not being achieved for this year. So again, it's telling us why, and you can use that for any of the indicators. And I think that's kind of game changing, because not only can you see why someone's on it, you can also put any patient's NHS number in and see why they've not achieved that. And that's a lot easier than trying to do that in SystmOne, I think. So that's really good. And then lastly on here, any of these patients as well, like Charmaine said at the start, you've got the patient view. So I don't know, let's just say Hannah here, we want to look at what other indicators she's got. If I click view, it will open up a view of any other report that she's in. So we can see we've got the patient here. And then what we can do is, I might want to choose contracts, and it's basically going to say what other work she has to do. So we were looking at the HbA1c, but we can also see, we need to do this indicator and this indicator. There's the obesity weight with management referral. So you can then start looking at all of the other reports that patient falls into. And then you have got the ability to open up that patient in SystmOne as well, and then start working on them there. So again, really, really useful. You've got all that information at your fingertips in Ardens Manager. Sorry, I'm conscious of time now. That's obviously the QOF register. All of the QOF stuff's there. I mean, I'm very quick overview, but you've got your vaccinations as well. You've got your smears. And there would also be under contracts, you do have your network contract DES as well. So just to quickly show you that before I finish. So not only have you got QOF, network contract DES, and look, IIF. And again, there's all of those IIF things that I was showing you. It's all been updated. You can see, your learning disability, how many you've done. And I would be able to drill in and see exactly the same information that I just did on that QOF one. We'll cover more on the 14th of May. I'm going to shut up.
No worries. Like mentioned, these webinars are always top level, so please do make sure you book onto your training. We can then spend some more time with you, but hopefully that does give you a snapshot of Ardens Manager anyway. And like Nathan mentioned several times, we are doing a webinar on the 14th of May, so please do make sure that you book onto that too. I'm going to give Nathan a break from talking now, and I'll take over. Do you want to just open up a few slides?
Yeah,
there we go.
Care, that's one we wanted, wasn't it?
Yeah, we mentioned continuity of care already, but it's mentioned as part of the network contract DES that we have to make sure that we are implementing it as part of a PCN. As always, we are here to help you. So we do have reports in the clinical system, and also in Ardens Manager, you can narrow down your reports by risk groups, which is really handy. So if you wanted to filter out your patients who are a red status or a green status, you can. But this will all be covered in the webinar next week. So we keep saying webinars. So next week, we're doing the continuity of care. And then the week after that, we're doing Ardens Manager. And I would recommend booking onto both of those so that you've got all of the information that you need to carry out the work for the year ahead. So that's just explaining continuity of care. We also got a slide on neighbourhood health. Just really to say that we're here to support you in this area too. I know sometimes it's not really clear what we should be doing in this area, but we do have templates, recalls, planning tools, everything that you may need to help you connect and work as various different organizations. So if you are interested in setting up your hub sites or your community units or any sharing groups that you have within your area, please contact our accounts team. We'll be really happy to hear what you need and help you as much as possible. Remember, we will share these slides that you can take it. If you're not the key decision person, you can take that away and speak to your practice manager or any other manager within your organization. Okay, so we just wrap it up then. Yeah. So really, next steps. We know, you don't need to tell us, we know that there is a lot of information in this webinar, but remember, take the time now to watch the recording back, to have another listen, to access our support articles. We've also got Ardens Academy, which is our self-learning online tool that you can use. And we have various different QOF guides on there to walk you through the process. We are going to be updating those in the next few weeks, but those might be handy just to kind of, like, I'm the sort of person that I hear it, but then I need headspace to look at it myself. And that's where Ardens Academy will probably really help you. Dive in, have a look at the reports now, run them, make sure they all make sense to you. And remember, you can let our contact our support team if you have any queries. We've given you loads of different webinars you can join now over the next couple of weeks. I really recommend that you join them. We have put our upcoming webinar page for Ardens Manager and also SystmOne, so you can register on. And just in terms of training at ardens.org.uk, training for anything relating to Ardens, not just QOF. And we have split our training sessions. So if you just want to focus on QOF or you just want to focus on network DES, then you can do that. Please don't feel that we're going to be cramming everything in one training session. You can split those sessions. Recommend that you have training at least once a year. So if you haven't had it for a long time, book yourself on. If you have any queries, then you can contact our support team, support@ardens.org.uk, and they're ready and waiting for questions to be answered too. And then the last slide really is just to finish off with any feedback. And please do provide your feedback. We're happy to hear whether anything to help us improve, not just with our training, but also on our product. We're very keen to want to improve and make sure we're helping you as much as possible. So there's a QR code. It only takes a couple of seconds to complete that, but we would really value your feedback. But apart from that, really hope that you have found it useful, that you've learned a lot today. Thank you very much, Nathan, as well, taking us through that. And we will, the emojis are coming up, which is brilliant. So you've done a good job. I guess we'll see you on the next one, which is the continuity of care. And I need to, we've done so many webinars, haven't we? What day is this SystmOne one? Wednesday.
I can't remember. Wednesday. Yeah.
It's Wednesday
at
1 o'clock.
Next Wednesday.
We'll be back again. All right. Thanks everyone for your time.
Thank you.
See you on the next one. Bye for now.